As you know, the state has been fighting the impact of the devastating impact of the COVID pandemic since last year, since March 2020. And I have had the honor and privilege of being given the responsibility of coordinating with civil society organizations, NGOs, corporates, private sector, and international organizations to coordinate the COVID response as well as relief efforts. This has been an outstanding opportunity for me and for other members of my team to build sustainable networks and partnerships with civil society organizations and other corporate partners, not only in the field of medical donations, but also in the field of relief, providing relief to so many families and people who have been suffering different kinds of hardships due to the COVID pandemic. There have been tremendous offers of support and examples of support from NGOs, civil society organizations, corporates on responding to people's hardship in terms of hunger, in terms of providing relief kits, in terms of providing ration kits, transport, and so on. And this, I think, today is again one more example of such an important partnership. The project We Care for You, developed by Sparsha Trust as a support system for COVID-19 impacted children who've lost either one or both parents and who belong to financially marginalized families across Karnataka. As we know, COVID, especially the second wave, has had a devastating impact on families across India. Not only in the matter of obtaining beds, oxygen, causing tremendous anxiety, tremendous distress to families and to patients, but also in the loss of life, also in the impact it has had on the mental status of children, children who are especially not able to understand the depth of the crisis and the enormity of it, but who can see their parents struggling and who are suddenly caught by the anxiety of seeing a parent or both parents getting into hospital, struggling for oxygen, even in some unfortunate cases, losing their lives. So we know that the impact of the COVID pandemic on children is not only going to be financial, it's also impacting, it has already impacted their education. It is impacting their healthcare, and it's going to lead to long-lasting psychosocial impact. And therefore, we will need to work with children to help them with psychosocial counseling as well, in order to calm their anxiety, reduce their stress, and find ways for children to express their grief and move on to a process of recovery and restoration. At the same time, for children who have lost a parent, lost in many cases both parents in some cases, we need to, as a society, we need to come together to ensure that care and protection is provided to these children who are in extremely vulnerable situation only through the legal process. We need to come together to ensure that children are not abused, not trafficked, not informally handed over to other families, but in case of children who need care, whether it's short-term or medium-term care, that they are provided kinship care, preferably over a legal process with the complete information and decision of the child welfare committees. In this, I have no doubt that the organizations, highly committed organizations like Sparsha Trust, will work with the child protection services in Karnataka in ensuring a better and brighter future for these children who have already suffered so much and who will need all of us to come together to give them not only a secure future, but also an emotionally strong recovery through the trauma that they have expressed. I once again thank you for launching this important program. It's highly timely, and I know for sure that many children and their families will benefit from this. I congratulate the Sparsha Trust. I congratulate the Board of Management, all the patrons, all of those who have put this program together. Thank you so much. All my best wishes.